what the deal is, but I looked at Craig.
I'm filming this, I can't see, the screen doesn't work, the screen don't work in the back, so this is like invisible video, so.
What's your course in shape this summer? Because seniors.
Yeah, Andrew, a buddy of mine was telling me. I didn't even know. Did you watch it on the weekend? The young Canadian?
Yeah.
He did all right. Andrew Gannett told me he won the juniors in Sussex in 2000.
That's right. Yeah, that's right. I knew there was some kind of connection with your friend.
Yeah, that's
what it was.
Yeah.
No, he's good. He stayed in
Great composure.
I was impressed. He's still with us.
It's all good.
Do it anyway.
Yeah, the one in mine years ago or something. It's not the frame, it's the rails, the body mounts. A couple of other guys. Yeah, they around one piece.
Side door.
All I decided was part of the deal.
Comment tu fais pour mes noms avec ça?
Si, je peux pas avoir la chose à casser, là, right?
Celui-là, le pose
Ça, là, ouais, je pose, ça peut recorder, là. Là, je peux pas voir, ça, il faut que je clique sur l'autre caméra. Puis, m'amuser assez de l'autre. OK, watch out, qu'est-ce qu'il fait ici, qu'est-ce qu'il fait ici, ici. Je peux pas ici de l'autre, là. Je mets, ah, là, there we go.
Okay. Ladies, how are you? Good morning.
How's your health?
Unhealthy.
No, you go ahead. Oh, be careful. Just don't go behind the camera.
Just give me a shot.
Good morning, bonjour tout le monde. It gives me great pleasure this morning to introduce our head table. J'ai le plaisir de ce matin vous présenter nos tables d'honneur. Karen McGrath, President and CEO of Horizon Health Network, Président Directeur Général du réseau de santé Horizon. Gilles Tang, President and CEO of Vitalité Health Network, Président Directeur Général du réseau de santé Vitalité. The Honorable Hugh Flemming, Minister of Health, Ministre de la Santé, The way the proceedings will go this morning, we'll see remarks from Ms. McGrath, remarks from Mr. Longtang, and then remarks from Mr. Flemming. Une séance des questions et réponses aura lieu après la déclaration du ministre. A question and answer session will occur following the minister's remarks. During the Q&A session, we will be using a microphone. When you're asking a question, please identify yourself, your news organization, and who you're posing the question to. Lorsque vous posez une question, voulez-vous identifier votre organisme de presse et indiquer à qui s'adresse la question. Ladies and gentlemen, here we go.
Thank you very much, Bruce. Hello, bonjour. Mr. Flemming, my colleague Julian Tang, dignitaries, special guests, and the media. I'd like to acknowledge our two board chairs in the room from Horizon and from Vitalite. Thank you for joining us. Today I'm here with my colleagues to share details on our new healthcare reform changes. Now I am aware that information about these changes has been circulating online and in the media over the last few days. So today I want to provide you with the accurate information about these changes, which includes background on why these changes are being made. As President and CEO of Horizon Health Network, I know these changes will improve the quality of healthcare delivered to New Brunswickers for years to come. These changes are based on a careful and thorough review of Horizon's programs and services, coupled with the needs of our patients and our clients, and of course, the reality of our staffing resources. I have recommended these changes to government to ensure Horizon is able to continue delivering quality and safe care to all New Brunswickers. In order to do this and really improve care, we must make significant changes to the way we're currently doing things. Too often, our facilities are facing decisions on whether to temporarily close beds and units. This is not the way healthcare should be delivered. New Brunswickers deserve better. We realize there are parts of Horizon that are not working as well as they could and should. We also understand that things are not going to magically improve overnight. It's time to act to make the changes that are needed today for a healthier tomorrow. To truly improve health outcomes for our patients and clients, increase access and eliminate the service interruptions that have been plaguing our healthcare system, the following changes will be implemented within the next 3 months. 3 Horizon facilities are part of this change. Hotel Dieu, St. Joseph in Perth Andover, Sackville Memorial Hospital, and Sussex Health Centre. At each of these facilities, the emergency departments will change from offering 24-hour service, 7 days a week, to operating 8 a.m. till midnight, 16 hours a day, 7 days a week, with the last patient being registered at 10 p.m. This will be effective March 11th of this year. These emergency departments will continue to be staffed by a physician, registered nurses, and support staff who will have access to diagnostic equipment such as X-ray, blood work, and specimen collection. We understand that these changes may cause concern to some, since we all know emergencies can happen at any time of the day or night. The reality is that on average, these emergency departments saw only 5 patients per night, and most of these cases were not emergencies. In critical situations such as trauma, heart attacks, and strokes, ambulances also often take patients directly to larger centers where they can access the specialized services they need. These emergency departments will continue to play a very important and vital part in our organization. Physicians will still be able to refer to specialists and order specialty tests such as MRIs, CT scans, and scopes. As you know, we recently announced our intention to add more nurse practitioners into the system. We understand these rural communities are also dealing with access issues to their primary healthcare providers. So I'm very pleased to announce that we will be adding a nurse practitioner in each of these 3 communities.